Senator, thank you very much for joining us this hour. Let me first get your reaction to what we see playing out there on the Senate floor with what the Majority Leader, Mitch McConnell, is trying to do, trying to get that additional $250 billion passed. As you saw, as we just mentioned, there's some of your colleagues on the Democratic side say this is a non-starter. Tell us why.
Well, because he's just dumping money. This is a political stunt by Senator McConnell, again, just like he did when we were discussing and in good faith discussions and negotiations about how to get COVID-3 done. He did the same thing. Put something on the floor of the Senate that he knew was not going to pass so he could have a political message. It's really very disappointing because instead of just coming to the table, sitting down and saying, what can we do? Let's figure out what we can do. He puts this thing on the floor, announces that he was talking to Senator Schumer when he wasn't talking to Senator Schumer. And the point is that Democrats and Republicans alike all believe and want to put more money in this SBA fund. The payroll protection plan had some serious issues with the rollout. We're trying to work those out. We're trying to see how much money is needed, where this needs to go. This is a matter of discussion. The American people don't need to be seeing dueling unanimous consent motions that are both going to fail on the Senate floor. What they want to see is results. And by putting this on there, Senator McConnell is just once again playing politics with the American people. And it's really sad.
Yeah, so let's speak about results for a moment. As we just mentioned there, your colleagues, the Senator Cardin, Senator Van Hollen, they have an alternative proposal. Can you shed some light as to what their proposal would entail?
Well, look, this has all come up in the last 48 hours. I haven't talked to them, and I know that there's a proposal that they've got that will include more than just simply the SBA loans. You know, I think part of the discussions that we have to do right now and that have to take place is, do we do some things incrementally? Do we focus on health care and hospitals in one package? Do we focus on the SBA and the payroll protection in another? Or do we try to combine that? But the problem is going to be that we've got to sit down and talk about it, not just start throwing things up on the Senate floor only to have them shot down. Everybody wants the same objectives. There is no question in my mind about that. It's just a question of how we get there. This program has only been in effect for a few days. We need to see it's had a lot of bumps in the road. The banks are issue. I think Democrats, especially me, want to make sure that our underserved communities have an opportunity to get some of this money, where right now they don't appear that they do. So there's a lot of things that need to be discussed. That's the way that we need to do it.
Let me get your reaction, sir, to the numbers this morning. The unemployment claims, as you could, obviously, you're fully aware, skyrocketing once again, a total of about 17 million over the course of the last 3 weeks. That's almost 10% of the workforce in just those 3 weeks. What is your overall impression and reaction to where things go from here for Americans?
Well, look, I'm not surprised. We've seen this for those that have been following this and looking at both the economic impact as well as the healthcare impact. I don't think that those numbers should be surprising to anyone. I think the question is how long that's going to be, how long we're going to do this before people can start getting back to work. I think that's going to be a little bit longer than people really fully appreciate right now. People are getting antsy. They are getting anxious about trying to get back to work. But I think it's going to be up to Congress to continue to monitor this, to make sure that we keep in place that stabilization to keep the economy from just completely tanking. Everyone calls what we've done a stimulus package. It's really not stimulating the economy. It's trying to stop it from being in a complete free fall. We're going to have to continue to monitor that, do it on a bipartisan basis so that we can find that common ground, do those things for the American people.
Let me talk a little bit, if I can, sir, about your state, Alabama. New data showing that African Americans being killed by the virus at a disproportionate rate. More than 40% of coronavirus deaths in the state of Alabama have been African Americans, even though only about a fourth of the state's population is black. Talk to us a little bit about what the state needs to do to address that disparity urgently.
Well, the state initially, we did not expand Medicaid, and we really have to take a very serious look at expanding Medicaid. Now, that is a little bit more, that's a short-term and a long-term solution. But we've got to get testing into some of these areas. We have seen in the Black Belt areas of Alabama and in our minority communities a lack of testing. We've been talking about that for the last month to try to get more testing in there. I think that there will be more cases. What this is doing is shining a light. It's really shining a spotlight on those things that we already know, that there are racial disparities, not just in the South and in Alabama, but throughout the country. There are racial disparities, there are economic disparities, and we've got to start addressing those right now to save people and to also address the systemic problems that we see down the road. I think Medicaid expansion in a state like Alabama would be a very, very important step for us to take.
Let me, sir, finally ask you just about the overall preparedness of the states in the South. About 1 in 10 coronavirus deaths in the U.S. has occurred in that four-state arc of Louisiana, Mississippi, Alabama, and Georgia. Your state just enacted the stay in shelter or stay in place or stay at home order that went into effect Saturday evening. Is the South prepared? Did your state act a little bit too late?
I think most of the South started all their preparations a little bit late. Now, I can tell you our public health officer, our EMA director, they were looking at this and they were getting prepared. But I think throughout the South, we were getting the same mixed signals that the administration was giving for so long, that this is probably not going to be as serious as it is. We want to keep the economy going. We want to keep people working. We want to look toward football, those kind of things. And the fact of the matter is we were too late in trying to get these, not shelter in place, but stay-at-home orders, get people wearing masks, getting folks really serious about this. And frankly, we're still behind the curve on that. We're still trying to get those messages out to make sure people understand that their health is somewhat dependent on their neighbor's health, and everybody needs to do this. So I think they're catching up. I think I'm really proud of the way the EMA folks are handling this, and they're projecting. But the fact is we're behind the curve, and it's showing it now.
All right. Senator Doug Jones of Alabama. Senator, thank you very much for your time this morning. I appreciate it, as always.